Okay, are you 18 or older? Yes. Do you consent to this assessment videotaped for the purposes of my education to be viewed by a professor and possibly others at Liberty University?
Yeah.
Thank you. Okay, so through this I'm going to touch you a couple times. I'll let you know when it happens. We're going to be assessing your eyes, nose, mouth, ears, and your thorax. So let's start with your eyes. Okay, so I'm going to use this pen, and you tell me when you see it. Okay, keep your eyes forward.
There.
Okay.
There. 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 There.
Okay. That assesses the second cranial nerve, which is the ocular cranial nerve. So does the Snellen chart, and so does the Rosenberg test. Snellen chart, Snellen test. You put a Snellen chart on a wall 20 feet away from the patient. They read a series of lines. It tests at 20 feet what you see compared to what a regular patient would see at 20 feet. And if you see half or more, then we can say that you see at that particular fraction, whether it be 20, 20, 15, 20, or 20, 30, 20, etc. If you see less than half, then we have to go with the line above the bigger line. The Rosenberg, 12 to 14 inches from your eyes, you hold a card, you read it, you look at it, and if you can read it, look at it, it indicates that you're able to see up close. If you can't, then you're unable to see up close. And okay, so that's how those two tests work. They also assess cranial nerve number 2, the ocular. And so now we're going to assess cranial nerves 3, 4, and 6, which are the oculomotor, the trochlear, and the abducens. And we're going to do that with the 6 eye gazes, with the cardinal eye gazes. Please follow the pen and don't move your head.
Sorry.
That's okay. So the subject was able to follow the pen smoothly and completely through all the cardinal gazes, and therefore 3, 4, and 6 cranial nerves were assessed to be working. Let's see what's next here. So, okay, so now I'm going to. I would have an otoscope. I don't. I have a flashlight. That's what we're going to use. I'm going to do a couple things actually. Well, before I do that, I'd like to check your pupillary response to far to close gaze. Please fix your eyes on this, and I'm going to move it close to you. Please continue to follow. Right now, the pupils are at approximately 2 millimeters. Okay. They contract approximately 0.5 millimeter. That was a door. Okay. They contracted approximately 0.5 millimeter. When I took the flashlight that wasn't on away, they came open again. All right. Keep an eye on my nose. Okay, so I can assess that pupils are perla, pupils are equal, reactive to light accommodation. Now I'm looking at the eyebrows. The eyebrows are of medium length. There are no foreign bodies or scales. The skin is intact. Angel, stop it. That's the dog. Let's see. The eyelashes are of a short length. They're present, and I don't see any redness on the skin. The palpable fissure on both eyes bilaterally is clear, and there is a pinkness, and it appears supple. I'm going to go ahead and touch your face now, okay?
Yes.
Okay. I'm just going to take a look at your eyes. Okay, it's pink, reddish pink. I'm going to touch your face and checking the lacrimal sac. Lacrimal sac is soft and movable. There are no nodules. There's no hardness. Let's see. Okay, so I'm going to take a look inside of your eyes. Okay.
Yes.
Go ahead and look at my nose. Okay. I see an opaque lens. I didn't see any red reflex, but I think that's because I'm not looking with an otoscope. Let's see. Now I'm going to move on to the ears. Let's start. This is my tuning fork. It's a pen. Anyway, we're gonna pretend for the Rhine test and the Weber test. So I'm gonna go ahead and hit my tuning fork. Do you hear that, sir?
Yes.
Okay. Now I'm going to put it on this part of your head. It's called your mastoid. I'm gonna hold it there for 2 seconds and then away for 1 second. You tell me when it stops, okay?
Okay.
1 Mississippi. 2 Mississippi. 1 Mississippi. Stop. Okay. Okay. Stop. Okay. All right. Now I'm going to whisper something to you. What did I say?
I don't know.
Okay.
Chicken bun?
It was chicken foot. Close
Chicken
enough.
foot. Okay.
Okay. So his left ear appears to have some deficiency. Further testing would be necessary, of course. And I'm going to take and that was for the first cranial nerve, the auditory nerve that we just tested there. Now I'm going to look at your ears. I'm looking at the auricles. They're round, they're symmetrical. There doesn't appear to be any lesions or any foreign bodies. Let's see. Okay, I'm going to go ahead and feel your head, feeling the mastoid. The mastoid, upon observance or inspection, doesn't present with any. It presents as symmetrical. There are no lesions, no bumps. The skin appears smooth and intact, and upon palpation, the mastoid is prominent. There are no lesions. There's no nodules, no hardness. I'm going to go ahead and look in your ear, sir. I would have an otoscope, and I would be trying to visualize your tympanic membrane, which is your eardrum, but I cannot do that, unfortunately. I do see scant cerumen, some scant hair, scant cerumen, scant hair. I cannot visualize the tympanic membrane on this side either. What I would do is I would take an otoscope and place the tip on, the name of it, and I would pull up and back on the auricle, insert the tip, and with the light on, and observe. And hopefully I would see a cone of light. It would be preferable that the tympanic membrane is intact, without scarring. There's no black spots, no redness, no bulging, no concavity. And I would also be able to see the inner ear bones, the bones of the inner ear. Okay, so moving on. Let's see. Now I'm going to assess the thorax of the subject. I am inspecting the thorax. It appears to be symmetrical. The chest proportions appear to be proper at a 2:1. 2 width, 1 deep. There is concavity to the chest at approximately 2.5 centimeters, and I measure that with my finger, knowing that my joint is 1 inch, and it is the only way I can do it. I don't have any tools for this. So that is approximately 2.5 centimeters concavity to the chest. I'm going to ask you to say 99.
99.
Please say 99 again.
99.
Tactile fremitus posteriorly and anteriorly bilaterally is present. Let's see. Okay. That's okay. So then if I do that again, okay. So I'm gonna ask you to breathe in and out. Series of breaths.
Okay.
Can you you know what? One more thing.
Yes.
I'm gonna tap your face. Okay? It's gonna be very close to your eye.
Okay.
I'm just checking for corneal reflex. Okay, corneal reflex present bilaterally. All right, now I'm going to ask you to take a deep breath a series of times. If you start to feel lightheaded or feel uncomfortable, let me know. We'll take a break.
Okay.
Okay, what I'm going to be doing is listening to your lungs. And actually, before I do that, I want to listen to your heart. I don't want to speed your lungs up. Yeah, or your heart up. Let's do that first. Okay. So, second intercostal space on the right sternal border. I hear S1 and S2 clearly. Now I'm checking with the bell. The aortic valve is prominent. Now I'm checking the pulmonary valve. S1 and S2. S1 and S2. Let's see. Okay, second, third, and fourth. The point of herb. S1 and S2. Same. herb. At the third and fourth. At the fifth will be the point of maximal impact, and the and the tricuspid valve. S1 and S2, clearly on both. And now for the mitral valve. S1 and S2 present. I hear valve sounds. Okay, and I hear the mitral valve as well. Very quiet. Okay. Let's see. Okay, now I'm gonna have you. Oh, is it right? Yeah. Okay. So now I'm gonna have you breathe. Okay. To ask you to take a deep breath, and a series of deep breaths. I'm gonna listen to your lungs. I'll listen to a lot of parts, unfortunately, but we'll get through this. If you need me to stop, just let me know.
Okay.
Okay. You need a break now?
No.
Okay. You know what I need to do though? I need to take a scan of the room to show that. Now, forgive me, Professor. My house is not clean. I'm a bachelor and a single father, so you can see bikes. There's papers all over, but nothing that I can read from here. Everything. This area is clean of anything that I can see. Even up here, there's nothing written up here. You can see it's just tape. Yeah. Anyway, look. You got a song there, okay? And yeah, I just want to show you, so you know. Let's see here. Make sure this is good. Okay. This appears to good right there. Okay. Now I'm going to listen to your lungs.
Okay.
Okay, I'm going to start at the bottom or top and go to the bottom, okay?
Yes.
So, take a deep breath. Vesicular, go ahead. Oh, sorry. Go ahead again. Okay, vesicular, bronchovesicular. Another breath. Vesicular, bronchovesicular, bronchovesicular, vesicular. Again. Vesicular, bronchovesicular, bronchovesicular, vesicular. Take another breath. Another. Can you do that one again? Okay, that one was kind of vesicular, vesicular, vesicular. You need a break at all?
No, I'm good.
Okay. All right, now I'm going to listen to your posterior lungs. Go ahead and take a. Thank you. Both vesicular, vesicular, vesicular. Oh. Thank you. Vesicular, 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 Vesicular. Vesicular. Okay. Thank you. How you feeling? Yeah. Okay.
Flying.
All right. Okay. So now I'm going to percuss. Okay.
Yes.
Which means I'm gonna put my finger on and bang it. I'm gonna listen for a sound. Okay.
Yes.
All right. That's kind of dull. Oh, now I have to find it. Resonant so far. There's dull here, resonant here, resonant. Okay, resonant. Would you mind leaning forward, please? Thank you. And try to relax your shoulders if you can. Thanks. Resonant. 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 Oh, sorry. Resonant. 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 Dull. Dull. Okay. Okay, so let's see. Let's see what's next here. Okay. All right. Now I'm going to palpate your thorax, front and back. Okay.
Right.
All right. So, just looking for any abnormalities. Up here, I'm looking for any popping, any nodules, any hardness, lumps. Thank you. Thank you. Appreciate it. There you go. You can put your arms down for now. Your muscles feel a little tight up here. Oh, okay. Muscle tone is fairly good overall. The muscles of the upper shoulders around the neck appear to be tight. I don't feel any bumps, nodules, or hardness. Skin is freely movable. And let's see here. Okay. So now I'm going to check some pulses. Okay.
Yes.
This is your temporal pulse. Okay. I can palpate the temporal pulse. It's strong and regular. Okay. Just cover the bases. I'm going to do the carotid again. I don't know if I have to for this one because I did it in the last one, but just to cover my bases because it's part of the cardiovascular system. I'm going to go one at a time. Okay. It's strong and regular. Strong and regular. If I were to try them both at the same time, it could slow your heartbeat or stop it by depriving your brain of precious blood. And if we stop your heartbeat, I think that'd be a bad thing.
Yes, I
Yes.
agree.
Okay.
Doctor.
Doctor, I am a nurse.
Oh, okay.
Thank you.
Yes.
Okay, so now I'm going to check some other pulses. Let's see, I'm going to check your brachial pulse on this side. Ooh. Sorry. I know it's my fault that I'm not finding this. Sorry.
It's okay.
I should have practiced this before I started the tape. Okay. I feel the brachial pulse faintly. Okay, I feel it a little stronger on that side. I'm thinking, let me try again. I'm going to question my assessment skills. It's been quite a while since I've had to assess. And I'm smart in doing that. I was stronger that second time. Now I'm going to check your radial pulses. Okay, strong. Your left is actually a little stronger than your right. So, oh, you have a bruise. Oh, what, did they take blood?
Yeah.
Okay. All right, so those pulses are taken care of. Still a strong pulse. They're not equal. The right brachial and the right radial pulses are weaker than those in the left. Now I'm going to check your popliteal pulses. Okay, let's see. I'm going to straighten it. Okay. Okay, they're even, but they're weak. But they are even. Let's check. A little thready, I guess, is the proper terminology. Okay, go ahead and relax. Posterior tibial. Okay, even, thready. Is your foot relaxed?
Yes.
Okay,
This
that's
is
fine.
the the damaged leg.
Okay. When did that happen? Last week?
About a week and a half ago.
Okay. I feel the pedal pulses, the pedal dorsalis, are thready, and but they're between thready and strong, and they're equal. Capillary refill is less than 3 seconds. Let me get your socks back on, sir.
Thank you, nurse.
No problem, and I believe that concludes our assessment. Let me think, if you don't mind, for just a minute. Think if I forgot anything. And I don't believe I have. Thank you, sir, for your time. I appreciate it very much.